It has never been more clear that we need a new response to meet the mental health needs of our youth. The social, emotional, behavioral needs of students has never been more prevalent in our country, and the need continues to grow. Suicide has gone from the fourth leading cause of death to the second leading cause of death among youth and young adults. 1 in 6 youth experience a mental health disorder, and only about 50% of those youth receive treatment. Lack of student access to treatment leaves schools as informal mental health providers, which is okay because school mental health research says youth are more likely to complete treatment when offered in school settings. The increasing need of our youth and communities makes it time to break down silos of service delivery and focus on a whole population response. Schools have been using a prevention-focused, tiered logic known as PBIS to organize and allocate resources to support behavioral needs of students for decades. And school-based mental health has grown during this time period as well, while powerful and more effective to have supports within the schools. Often, school teams and community partners still work in isolation, not knowing the supports the others provide. The Interconnected Systems Framework draws on the strengths of both systems to create one single system of delivery, while also focusing on increasing the confidence and competence of all school staff to rigorously and continuously support the mental health of all youth. Before we provide enhancements to the current systems, we first need to celebrate the progress that has been made. Through the advancements of both school mental health and PBIS, we are at a tipping point where mental health and wellness for all students, staff, families, and communities is a top priority. There is awareness and even support and policy for increasing mental health clinicians within schools. SEL is being prioritized and taught like academics to all students by all staff. There is increasing awareness of childhood trauma and understanding of the impact on learning. While these are huge celebrations, there is still work to be done. Now we need to move our focus to designing our systems to integrate these successes in the most efficient and effective ways. First, we must alter our systems so that we utilize the social, emotional, and behavioral expertise of school and community clinicians on teams, who are selecting evidence-based practices together that align with the need of the community, the resources available, and the capacity to implement. Then define one continuum of supports matched to the needs of their students, families, and staff, and use data to drive how students enter and exit interventions, helping move away from a traditional referral handoff approach. Integrated universal teams can focus on prevention by using data to expand and prioritize the social, emotional, behavioral competencies being taught to all youth, and align the skills within systems such as our school-wide matrices to create consistency. Then integrated teams create procedures and structures for routinely monitoring all practices that are put into place to ensure the end result impacts student outcomes. We also must invest in the time, space, and coaching for teachers to embed social, emotional, and behavioral teaching alongside academic content. Sustainable change comes from systems change, and the ISF provides the structure and processes to enable this change to occur. If you are ready to begin an integrated way of work, see video 2 for an introduction to using the tools and resources available within Volume 2 and Implementation Guide.